Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is responding to dementia-related behaviors, sponsored by Prince George's County Government and the Department of Family Services.
So let's talk about understanding and responding to dementia-related behaviors. And as we go to the next slide, we're going to look at what this evening's objectives will be. Hopefully by the end of the program this evening, you will, one, be able to identify common triggers for behaviors associated with dementia. Secondly, explain the process for assessing and identifying challenging behaviors. And then finally, list strategies to address common dementia-related behaviors. Let's go to the next slide. What we're wanting to do this evening is to talk about a process, if you will. Some of the most difficult behaviors for caregivers to understand and address arise in the middle stages of the disease. In this process, we're going to outline, hopefully we'll be able to get at some of these behaviors that occur in the middle stage. And just to remind you what the middle stage of Alzheimer's is, dementia symptoms are more pronounced. The person may confuse words, they may get frustrated or angry, they may act in unexpected ways, such as refusing to bathe. The nerve cells within their brain is further damaged. It can also therefore make it difficult for them to articulate their thoughts and perform routines of daily activity. So they may end up forgetting events or personal history. They may be very moody or withdrawn, sometimes agitated. They may be unable to recall information about themselves, like their address or their telephone numbers. They may require, as I said, help with activities of daily living, such as dressing, bathing, eating, things of that nature. And they may also have a difference in their sleep patterns. And so all of these behaviors in the middle stage, these behavioral symptoms can be caused by physical discomfort, possibly. So what we're going to talk about, what's going on in terms of these 5 areas. If there's behavioral symptoms, is there fatigue or hunger or thirst? They may have constipation or a full bladder, or the room temperature may be too hot or too cold. Also, behaviors may also be triggered by overstimulation, sadness or loss, boredom, isolation, or changes in routine or one's living situation. Also, the causes may be hard to sort out. So it's helpful to take the steps we're going to outline this evening to understand and respond to the needs expressed through these behaviors. And sometimes, again, these behaviors may be nonverbal. We will present an outline of the steps to take, and we'll then apply these steps to some of the most challenging behaviors that caregivers commonly face. So let's move on to the next slide. And so as we talk about this process, the 4 steps that we're going to talk about this evening are the following. 1, detect and connect. 2, address physical needs first, then address emotional needs, and then you're going to reassess and plan for the next step. So it's kind of a loop, if you will. Okay. So in terms of detecting and connecting, let's go to that slide. As we talk about detecting and connecting, it's a matter of joining the person in his or her reality by trying to see the world through his or her eyes. Secondly, understanding the person's reality in context before intervening. What's going on? Who, what, where, when, how? What took place before, during, or after the behavior? And then approaching the person calmly and respectfully. So just to give you a few examples, one of the things I didn't share, as a volunteer for the Alzheimer's Association, besides doing community education programs like what we're doing this evening, I also lead 2 support groups, and hopefully in August we'll be adding a 3rd, an all-male caregivers group. But I lead 2 support groups for the VA with staff from the VA. And as an example, names and dynamics have been changed to protect their identities, but one group member mentioned that her husband is a Vietnam veteran. And on occasion, particularly in the evening, he would begin to get paranoid, for lack of a better word. And he would start to say, I'm seeing this thing. Leave me alone. Don't touch me. Don't hurt me. That sort of thing. And at first she was like, sweetheart, there's nothing in the room. Shut up. Be quiet. That sort of thing. But then she realized, being a veteran, what he may have been experiencing is a hallucination of seeing the enemy, a Viet Cong. So eventually she would come, she would sit next to him, calmly touch him on the shoulder and say, sweetheart, I'm here with you. I'm going to protect you. They're not going to hurt you. So she was able to join the reality, if you will. In terms of a who, what, where, the reason I became a volunteer for the Alzheimer's Association, my late wife, unfortunately, was diagnosed in her mid-50s with early onset dementia, 2 years later with Alzheimer's, and then 2017 passed away from complications of Alzheimer's. I was fortunate to have her in daycare. But as an example, one time she was sitting in daycare at a very noisy table during lunch. In other words, there were other individuals that were talking loudly, they were joking, and she perceived that loud talking as if they were talking either about her or they were saying something that just irritated her. So she would get loud and would curse back. The staff realized they needed to move her either to a quieter table or even on occasion to a table by herself. So those sorts of things were able to help calm her down. So again, joining the person's reality, understanding the context of what's going on. Is it too loud, noisy, this, that, the other thing? And even though their behavior might be sometimes very frustrating for us as caregivers or bothersome, they're repeating themselves, it's critical that we approach them calmly and respectfully so that we're not further adding to their level of discomfort or their agitation. Also, it's important to be able to understand that the behavior may be coming from environmental factors. And so again, is it too hot, too cold? Are they sitting in an area with their sunlight getting in their eyes, or the music is too loud? That sort of thing. So these steps, by joining them, by understanding what the environmental factors are, can be helpful. Again, another example, what's that person's tone of voice? I know another example with my late wife, there was one staff member that had a very kind of commanding sort of voice. And, when they would say, it's time for lunch, Mrs. Smith, or go sit down, it would startle her. Sometimes it would agitate her, versus another staff member had a more calm, Miss Bernita, come on, sweetheart, it's time for lunch. Miss Bernita, come on, it's time to sit down for the activity. So, be mindful and cognizant of how you approach that person in terms of your level of calmness, your level of respect. The other thing is not to surprise that individual. Coming from them in the front, identifying yourself, sometimes suddenly being touched on the back and not knowing what's going on can be startling and can create some agitation. And as I said, be mindful of your tone, your body language, that sort of thing. So let's now talk about, as we move to the next slide, addressing physical needs first. And as we're talking about addressing physical needs, always begin to explore any needs that may be related to physical pain or a medical condition. So it's important to consult one's healthcare provider to identify the causes related to medications or illness. Note any signs of injury due to incidents such as a recent fall. Is there some bruise or injury going on? Again, consult with a doctor. Urinary tract infections for both men and women can often increase agitation. If there's some issue with one's diabetic level, a spike or a decrease in sugar level, that might cause some irritation. Also, people with Alzheimer's disease often experience pain from undiagnosed underlying conditions. There may be a compression fracture, there may be some arthritis going on, poor fitting dentures, indigestion, or other medical conditions. Sometimes, too, individuals may react to new medications in ways that might increase a level of agitation. So the other thing, too, is to make sure you're talking with your loved one's healthcare providers to always reassess what medications are being prescribed. Are there any counterindications? Might they also contribute to some form of increase in certain behavioral indices? Their needs may also not be recognized due to the person's inability to recognize or talk about his or her symptoms. So in other words, again, it gets frustrating, I would imagine, for somebody with the middle stage of Alzheimer's if they can't express. Expressive language is often very compromised at this stage, and so they can't express what's going on for them. but inside they probably emotionally are feeling very frustrated or angry, that sort of thing. Also, it's important to note any unusual behaviors or symptoms, and again, be in partnership with your healthcare provider. Report them immediately. Also, check for physical discomfort due to environmental issues. Is the clothing too restrictive? Is it too warm if it's cool in the house? Are there lighting problems? Again, the TV is too loud or glaring, or the sunlight is shining in their face, that sort of thing. Additional common causes of discomfort include hunger or thirst, the need to stretch or move. Have they had an opportunity to get up and walk about for some part of the day? The need to use the bathroom, so making sure, again, they may not be able to express themselves anymore, but on some routine basis, getting them up to check to see if they need to go to the bathroom. Again, making sure environmentally it's not too loud, too noisy, that sort of thing. And so adjusting the environment appropriately is one thing to do. And during this physical assessment, continue to connect with the person and maintain a calm, soothing presence. This is particularly useful for helping the person with dementia to reduce any level of agitation or upset related to whatever underlying pain might be going about. Moving on to the next slide. Next, we're going to talk about what we need to do in terms of focusing on their emotions. So in this instance, how does the situation feel to that person? This is usually the basis for his or her behavior. In other words, focusing on the underlying feelings instead of the facts. So somebody might say, that person's coming, this person's coming, this person's coming. Maybe they keep repeating themselves, again, because they're in discomfort. Maybe, they need to go to the bathroom. Don't get into the process of trying to correct them, because if we're trying to correct people and say that they're inaccurate, no, mom's not coming. She's been dead for 2 years. No, Cindy is not coming today. She's coming tomorrow. It's important to not, again, add to their level of frustration. It's important to treat them and value them with a sense of respect and dignity. Oftentimes telling a loved one that they're wrong will only escalate the situation and convey that you don't understand. And therefore, your loved one may try even harder to convince you, so you get into this tit for tat sort of thing. Let the person know that you're with them and that you're there to help them feel safe. So again, as I mentioned at the example with one of the support group members, she joined her husband. It's okay, sweetheart, I'm here. We'll deal with this together. Reinforce that they're there to help them. So that's the critical thing. Although you may not understand the exact meaning of the person's message, you can usually identify, again, the underlying feeling behind the behavior. Maybe they're scared, maybe they're upset, that sort of thing. And by doing that, this will allow both you to de-escalate the situation together, freeing up energy to direct elsewhere. Even if you're not able to fully understand what the person is trying to convey, he or she will know that you are there for them, that you're trying, which may again help to reduce frustration and anxiety. Finally, help the person redirect some of that energy he or she is expressing through the behavior by leading him or her towards behavior that is soothing or enjoyable. So, if there's some upsetting event, maybe taking them into another room, turning on some soothing music. Redirecting oftentimes helps in that regard. Moving on to the next slide. Unfortunately, we're still having issues with our video this evening. So I'll tell you a little bit about what Rose is talking about here. Rose's mother, she's in a Latina family, and her mother used to love to cook, but she's now unable to cook anymore. And so she gets very upset when she sees Rosa in the kitchen. So what they decided to do is allow mom into the kitchen. They have her sit, and maybe they allow her to fold some napkins or some other minor tasks while she's in the kitchen. That gives her a sense of purpose. That gives her a sense of joining. And so that helps to calm mother and help her be engaged on some level. And again, knowing what was going on with my wife, at one point in daycare, they would have her help fold towels as an activity. Sometimes she wouldn't join some of the other activities, but as they saw her maybe getting a little agitated, they'd say, Mrs. Smith, come help us fold the towels. She may not do it correctly. She may not do it fully, but it gave her something to do. This past week, we had our support group again with the VA, and I was reminding one of our support group members, even if your husband is not vacuuming or sweeping the whole floor, it's purposeful. So give him some minor task. And she said, I'll try that. And she said it worked. So that's kind of what Rosa was talking about. Giving a loved one some minor task, it gives them a sense of purpose and engagement. Okay, so we're going to move on to the next slide, which is going to talk about understanding and addressing the behavior. So in this instance, what we're talking about is, again, going back to detect and connect. One, you want to join the person's reality. How does the situation look now to the person with dementia? Do you need to explore other potential causes and solutions? And if so, what can you do differently? Once you have settled on an intervention that is effective, recognize that this type of issue may arise again. So it's important that you plan to reassess and go through things on a periodic level. Sometimes you may even want to write down, okay, today this issue arose, this is what we tried, and it worked. But it might not work the next day or the next week. So you're always kind of putting on your detective hat and going through the cycle to figure out what's going to be working next. It's important to recognize, again, the signs that the issue might return. Is it environmental? Is it medical? Is it something in terms of what's going on with them in terms of health, things of that nature? But as you're reassessing and dealing with it, you're trying to be of assistance, you're trying to help de-escalate the situation, and I'm sure your loved ones will greatly appreciate it. So as we apply these steps, the detecting and connecting, the physical needs, assessing what they might be, addressing the emotional needs, and then going through the reassessment phase, we're now going to talk about particular behaviors that we can apply these steps to. So we can move on to the next slide. Okay, we can move past that one. And let's talk about anxiety and agitation. Restlessness or pacing, distress or over-reliance on caregivers often happens in this instance. And when someone with dementia is restless or pacing, distressed, or excessively reliant on caregivers, he or she may be experiencing anxiety or agitation. So I'm going to share with you an example of Anne. She's a 75-year-old woman. She has Alzheimer's disease. She's pacing the hallways at the evening saying, I need to go, I need to go. She's not even stopping her walking routine, even for meals. Her family would give her sandwiches to eat while she's walking. Though she used a cane, she's getting blisters on her feet and she's lost weight. Her family would ask Anne to sit down, but as soon as she sat down, she would immediately get up and start to pace again. Anne had worked for 40 years as a nurse on the night shift, and her agitation began every evening. Her shoes were worn out, and she appeared to be in pain. So let's think about this. What might be going on? Maybe because Anne worked at night, and as sundowning, we'll talk a little bit more about what sundowning is, maybe she's getting into those sorts of behaviors. So one alternative would be during the day, making sure Anne has enough physical activity. Is there an opportunity to take her outside? Maybe an increase in vitamin D. Maybe even talking with the healthcare provider about, supplement like a vitamin D supplement. Giving her something to do that will occupy her, and making sure as you see her starting to walk about, maybe distracting her as a way of having her do something else. Again, maybe pulling her into another room, maybe even sitting her down, or maybe walking with her and say, Anne, tell me about when you were a nurse. What would you do? So you're trying to engage her in conversation, or if you knew exactly what Anne was doing as a night shift nurse, you're telling her, I bet back in the day you used to go around and check every patient. Would you like me to walk with you and check every patient? Oh, speaking of which, hey, look, this looks like a chart. So you may want to, again, distract. Oh, let's look at this. So, those are maybe some ways of dealing with agitation or anxiety. And if the person is anxious, being able to, again, calm them down, maybe using sight, sound, smell, touch, lavender, maybe smelling some lavender bath bomb or lavender flowers. That's a very calming sort of thing. Listening to some soothing music, that might help with reduction of the agitation. So we'll move on to the next behavioral indice that we're wanting to talk about. If we can move to the next slide. So now we're going to talk about confusion or suspicion, not recognizing familiar people, places, or things. When someone with Alzheimer's disease is confused, he or she may not recognize you as a loved one, the fact that they're in their own house, familiar objects. And when this confusion is accompanied by suspicion, the person may accuse others of stealing or being unfaithful. It can be very difficult for caregivers when the person cannot remember who that caregiver is. So we're going to talk about Anne again in the context of another example. And then we're going to talk through maybe some of the steps we've just gone through. So in this vignette, Anne's family comes to visit and evening begins. She becomes very suspicious that people are trying to get into her house and are watching her through the big picture windows. She becomes suspicious of her family for not making the people, quote unquote, go away, and that they're in cahoots with each other. Now, maybe what's going on in this instance, there's big picture windows. So imagine maybe Anne has 2 family members over, but looking through the big picture window, now we're thinking she's perceiving maybe 4. So maybe closing the drapes, maybe turning up the lighting so that, that might help. So that might reduce whatever might be going on with confusion or suspicion. Again, is there something else that's going on that's getting Anne to be suspicious? Has there been a change in her routine? So again, being mindful of routines or sudden changes in routines, which can exacerbate those sorts of behaviors. And I know, again, as a caregiver, it can be very frustrating sometimes trying to figure out what the heck's going on, particularly in the midst of a loved one's behavior. But again, it's important for you to remain calm. It's important for you to be able to check the environment. So again, is there something that might be triggering? The environment, again, lighting, the condition of the room. Is it too hot, too cold, their clothes too tight? Have they been to the bathroom recently? Giving them a snack. Maybe they're dehydrated. Sometimes dehydration in the middle stages of Alzheimer's can also increase agitation. So making sure they're well hydrated, things of that nature. That might be able to help. Okay, so moving on to the next slide. We just talked through this. So going through those steps, what's going on underneath, why is someone being confused or suspicious, and then trying to address their emotional needs, trying to comfort them. Okay, we'll move on to the next slide. And in terms of aggression, aggressive behavior may be verbal or physical. It may occur suddenly for no apparent reason, or may emerge following a trigger. So again, somebody might become aggressive if the TV is up too loud, if they're hearing voices in another room. And again, they can't say, could you quiet down? But in their head, they may be hearing it as tons of people shouting at them. And so that creates some level of aggression. Is it a certain time of the day? Was it a loud noise that might have startled them? So again, going through the steps, trying to reassure them, trying to calm them down. More often than not, people with middle stage Alzheimer's, they're not going to be aggressive to the point that they're going to harm themselves or others. But if somebody, and the other important thing, if somebody is very, very aggressive, and there's access to in the kitchen knives or some other things, making sure there's safety in the house. And if need be, if it gets to the point that it unfortunately is exacerbated to a really aggressive situation, calling 911. But making sure when you call 911 that you're asking for trained personnel that understands that a loved one has Alzheimer's, and that they know how to respond appropriately and safely in those sorts of incidents. So we'll move on to the next slide. And we've just talked about the prospect of detection, the emotional, going through the steps that I just mentioned. So we'll move on to the next slide. And as I said, usually aggressive behaviors associated with dementia are upsetting, but they're not dangerous. Occasionally, the person is in danger to themselves or others, and safety measures are necessary. So again, making sure there's no knives around, that sort of thing. Is there something medically going on? UTI, believe it or not, can increase aggressive behavior or agitation. I mentioned diabetes and sugar levels. Again, the importance of calling 911 as needed and making sure that personnel are trained to understand that your loved one has dementia or another medical condition and can respond in an appropriate, safe manner. Okay. Moving on to the next slide. One of the things that truly occurs, particularly in the middle stages of Alzheimer's, is repetition. A loved one will constantly repeat themselves. Where are we going? Where are we going? Where's mom? Where's mom? I hear Sally. I hear Sally. And, we might say, mom's not here anymore. She's dead. That's quite harsh. I know with my late wife, her mother passed away 3 years before the onset of her illness. And so when she would say, where's mom? Where's mom? I'd just say, sweetheart, mom's not here right now. She's at peace. That's true. Mom was at peace. She was with the dear Lord, but she wasn't here. And then I would kind of redirect it. Oh, Bernita, here, let's look at this, sweetheart. What do you think about this? And so that would kind of get her off that track. So again, people might repeat themselves. Are they thirsty? Are they agitated? Is there some underlying health issue that is raising that type of behavior, the repetition? So it's important to be able to understand that, address it, and deal with it in a calm sort of manner. So we're going to move on to the next one. We can't hear the video, but Dr. Fazio basically in this one is talking about how repetition is a part of the illness. And for us as caregivers and family members to understand that, to be patient, things of that nature, so that we can deal with it in a calm manner, okay? So we'll move on. So we talked about repetition, again, going through the stages, what's going on, we're going to detect and connect. Are they repeating themselves because they're anxious? I know if we were talking about the situation with Anne, so here's the situation. Anne's daughter is due 2 weeks to come visit. And so every other hour, Anne is saying, where's Cindy? Where's Cindy? Where's Cindy? So is Anne needing to go to the bathroom? Maybe, she's not been nourished during the day, maybe giving her a snack, that sort of thing. Some of the ways maybe to deal with repetitive behavior, in Anne's example, showing pictures of her daughter, having her talk to the daughter, that sort of thing. So if a loved one is repeating themselves, again, I know it can be very frustrating as a caregiver. You just got to keep sometimes responding to them or distracting them to another activity, or giving them some liquids or feeding them as a way of introducing another activity that maybe helps to minimize or reduce that repetitive type behavior. And sometimes if the repetitive behavior is them walking to and from, as long as they're safe, that they're in the house, don't worry about, the walking to and from other rooms. I know sometimes my wife would get up and she would walk around the first floor of our house. And so myself and the caregiver, we're like, okay, she's fine. We make sure, if she were in the kitchen, we're there with her so she wasn't getting into anything that might be unsafe, turning on the stove, opening up drawers, that sort of thing. And then we would eventually, after she did 2 or 3 spins around the first floor, we'd redirect it. Hey, Bernita, look at this, sweetheart. Or here, I've got some watermelon for you. So again, giving her a treat, giving her something nutritious, and that would help decrease that type behavior. Let's move on to the next behavior. So let's talk about wandering. At some point in the course of the disease, approximately 60% of people with Alzheimer's or other forms of dementia will wander. This behavior may take place without warning, and so many families are unprepared. So again, applying the steps. What we might want to do, let's go to the next slide, is, have they had enough activity during the day? As I mentioned, sundowning, usually as the day gets towards the end, literally, figuratively, the sun's going down, you may see a spike in them wanting to get up, walk around, wander. But the other thing, have they had enough activity during the day? Have they been nourished enough? If they are wandering, have you created a safe space to ensure that they're not getting out of the house? Some individuals talk about putting a dark mat inside the front door or inside all the doors. Sometimes perception for a person with Alzheimer's, they see that dark mat and they think it's like a big black hole. And so they're not wanting to fall, if you will, into it. Or maybe putting socks or other objects on doorknobs, or even a bell, so that if you're hearing the bell, you're like, uh-oh, they're at the front door. I know one of our group members talks about she has all the doors to her house locked. She knows sometimes when her husband loves to wander, she has an enclosed backyard. And so, she has the kitchen door to the backyard open. And so she knows, because she has a camera too all around her house, that he's outside in the backyard just, doing whatever. And she's kind of adult-proofed the backyard, if you will, so that he's not getting anything unsafe. But she's allowing him to kind of burn off that energy by wandering around the back of the house, if you will. The other thing is with wandering, making sure maybe neighbors are aware of your situation. So if they see Mr. Jones down the street, they can call you up and say, hey, Mrs. Jones, I see your husband down here. And maybe they go out and engage and say, hey, Mr. Jones, how are you? And by calling you, you come down, you get your loved one and take them back, that sort of thing. Also, the Alzheimer's Association, and at the end of the presentation, Mr. Watson maybe can help remind me what the actual site is off the Alzheimer's website. But there is a safety program that Alzheimer's has in conjunction with local governments that, again, if somebody's wandering outside the house, making sure we can engage the police or other entities to help them. Also putting on, one of those safety alert things that can help identifying them, that sort of thing. So let's move on to the next situation. So we're finished with the behaviors. Now we want to, again, reinforce, besides the resources that Erica has shared with you, that the Alzheimer's Association can be an additional resource. We have a 1-800-272-3900 website, helpline. We have trained counselors that can speak over 200 languages. They can help you 24/7, the middle of the night, first thing in the morning. We have our alz.org website that has tons of information, community resource finder, the ALZ Connect, Alzheimer's and dementia information. Again, there's information about safety planning through our safety center, things of that nature. So that's the end of our presentation. Why don't we open it up now for questions? And you can put your